morning, everybody. My name is State Representative Matthew Wilson, and appreciate you being here today. This morning we are calling on Governor Kemp to include Medicaid expansion on the agenda for our special session later this year. And I just want to start off by saying I'm sure you, like me, have seen the speaker's comments this morning dialing back and on what should be included in the special session. But with all due respect to the speaker, the Constitution makes it clear that there's only one person who sets the agenda for a special session, and that is the governor. And this governor has made it clear that he wants to expand the scope of the special session beyond the constitutionally mandated redistricting process. And he's also made it clear that he wants to expand Medicaid. So this morning, I delivered a letter to his office that was signed by me along with more than 2/3 of the House and Senate minority caucus members, urging the governor to include Medicaid expansion on the agenda for our special session. Last week, Governor Kemp called for an expanded scope for that special session, and if we are going to be including other things on the agenda, Medicaid expansion must be a top priority. It has to be our first order of business. The truth is that we have a perfect opportunity right now. The incentives to expand Medicaid and the reasons to do so have never been clearer or better. Georgia needs to seize this moment. And look, this isn't about partisan politics. It's about trying to act on a priority for all Georgians, Democrats, Republicans, Independents. The governor has been working on his plan, which would have covered fewer Georgians who are in the Medicaid gap and cost significantly more than a full Medicaid expansion. But his plan has all but been rejected by the federal government. At the same time, thanks to the leadership of Senators Warnock and Ossoff, Congress has increased the incentives for states like Georgia to expand, fully expand Medicaid. And the experts have determined that if we take advantage of those incentives right now, not only could we fully fund that full expansion, but Georgia would profit $700 million and create more than 64,000 high-quality jobs. The time for action is now, and it has to be legislative action. Obviously, we would prefer a full Medicaid expansion, but we have to address what is clearly a priority of both parties, and the special session is our first opportunity we have to get to work. I'm glad to be joined by Senator Elena, who is the chair of the Senate Minority Caucus, and I'll turn it over to her at this time.
Thank you, Representative Wilson, and thank you so much for joining us today. This discussion has been going on for far too long. It's been 10 years since we should have taken action and expanded Medicaid. The Republican leadership of our state has dragged its feet for over a decade now for ideological reasons. In the beginning, when the Affordable Care Act was passed, there were provisions in there that the federal government would cover all of the cost of Medicaid expansion to cover our uninsured population. Those falling in the Medicaid gap. And who are those people? Those are all people who work. They are people who are retail workers, restaurant workers, and many other industries. They are not, sitting at home expecting handouts. They are hardworking, and their jobs do not provide those benefits. At the same time, they didn't make enough money to qualify for subsidies to purchase private insurance on the exchange. Instead of doing what was the only common sense thing years ago and expanding Medicaid so that those individuals could be healthier and contribute more to our economy and our society for ideological reasons that are nonsensical, the Republicans have refused to act. It doesn't cost us any more money. The complaints that it was going to cost more money ring hollow. And we now have, as Representative Wilson said, a huge opportunity to make this right. Every year that we've delayed, not only are there hundreds of thousands of Georgians who remain uninsured, costing our hospital system, costing our economy, costing our communities, but we forfeit billions of dollars every single year that would flow into Georgia's economy. Anyone looking at this situation with clear eyes and a clear mind would say, wow, they need to expand Medicaid. And they would also say, wow, they should have expanded Medicaid 10 years ago. So let's not lose sight of the fact that this opportunity has been in front of us for 10 years. We have forfeited all this money to the detriment of our people, our economy, and our society. And frankly, it is an outrage. It is a complete outrage, and it makes no sense. It is mean-spirited. And while the time should have been 10 years ago, if we're gonna add things to the special session, there is nothing more urgent than taking care of this, finally. The governor has recognized that we do need to expand Medicaid. Frankly, there are people who in the Republican Party have recognized for quite a long time that this should happen. And frankly, I think they've been scared of misinformation in their base, in their voters. They know it makes no sense to continue down this path. In recognition of that, Governor Kemp came out a couple years ago and said, well, we'll do this very limited expansion. And it'll cover, the estimates were it'll cover about 50,000 people out of the 500,000 that we have uninsured. It was also going to cost just as much or more, and they were slapping on a work requirement. That proposal has been held up by the Biden administration. Why is that? Well, when the program was put into law, it is a health care program. Its policy aims are to provide health care for Americans. When you throw work requirements on top of that to get the benefit, that is not only outside the aim of the statute, which is what has made it illegal and struck down by courts before when governments try to throw work requirements on there, it also does not serve the aims of the program. And that's why there isn't a work requirement in there, because it doesn't serve the aims of the program. There are many people who need to see a doctor and get their health in a stabilized form before they can effectively work, especially in the types of jobs that we're talking about, where a lot of them you gotta be on your feet, many hours. So that's why it never made sense, and it isn't in the statute and has been struck down by many courts to require working before you get the benefit. That is really in reverse. So not only was the plan going to cover very few people at more cost, it also did not serve the aims of the program to further the health of Georgians so that they could work. But the governor has at least acknowledged, and we certainly in the Democratic caucuses were grateful for that this situation couldn't go on any longer, that we needed to expand. We've got to shore up our rural healthcare system, our rural hospitals, which have closed, many of them, and many still teeter on the brink of financial ruin due to uninsured populations, and said, all right, I'm gonna tiptoe out there. The waiver he proposed never made any sense, but thank you for at least acknowledging that there was a need and that we should try to take advantage of the federal dollars. Well, the plan is going to be denied very soon for the reasons that I've already explained. That that leaves the one option in front of us to expand Medicaid. And it will be, it's always been obvious. It's always been obvious that that was the only thing to do that made any sense for Georgia and for our state dollars. But now it will be even more blatant that that is the only thing to do. It is the most direct solution that ensures we will not have to come back and fix a broken plan once again. The sooner we can get folks in the coverage gap enrolled in Medicaid, the sooner they will have the security and health that they need to thrive in the workplace and within their families and within our society. Thank you. We are so pleased to be joined by several healthcare experts who do a lot of work down here at the Georgia Capitol. Who's going to go first? Laura Harker with GPPI.
Thank you. Hello everyone, I'm Laura Harker. I'm a Senior Health Policy Analyst at Georgia Budget and Policy Institute. And I really want to underscore just the urgency of taking up Medicaid expansion in Georgia at this time. We are seeing some positive signs of economic recovery with our growing revenues and some jobs coming back, but we're still only at the beginning. We're still fighting this pandemic. We know from our partners who work with small business owners, with working parents, with people who are behind on their rent and utilities, that people are still struggling. People are still trying to gain an economic standing and really regain that security. So we really need Medicaid expansion as not just a policy for healthcare, but really beyond. And so when looking at within the healthcare system, we know that hospitals are still responding to COVID-19. They're still treating patients, and they're also dealing with other crises. Hospitals and clinics are dealing with the growing mental health crisis. We're seeing more needs for crisis services in areas like mental health and substance use disorder, as we're seeing growing overdose rates as well. So there's a lot of help in the healthcare system that Medicaid expansion would provide. It would provide $3 billion a year that would flow directly into our healthcare system, helping us to pay for this treatment instead of it going unpaid for and creating more financial strain on our already strained hospitals, especially in our rural communities where we're seeing at least 2 hospitals since the pandemic began have closed, and several are still on the brink as far as just financially can be unstable. So that money really flows right into those hospitals to support those communities. And we also know that rural hospitals are a great job creator in those communities, and one hospital job can create 2 jobs in the surrounding community. So there's huge health benefits and economic benefits when we expand Medicaid. Also wanted to touch on just the importance of Medicaid in supporting families. Those families that are struggling, Medicaid can provide that financial security. They won't have to worry about going to the doctor and not being able to afford to pay for their treatment or their medications. They won't have to delay care. That would be more costly and also more damaging to them if they're delaying care instead of getting that treatment earlier. And that also saves money in the healthcare system. When we have people come in earlier and get treated, they're able to really make sure that they get a hold of those issues earlier, and that's more effective, cost effective for the system instead of emergency care, which is really expensive. So also in addition to that, just want to touch on the importance for children as well as we think about students returning to school and the benefits, not just for parents who would be able to get insured through Medicaid expansion, but children. We know that parents who are insured, their children are also more likely to be insured. So that also creates benefits as far as students being able to, more students having health care, being able to stay in class longer and able to complete their classwork as we move into the school session. And then also just wanted to underscore the new incentives through the American Rescue Plan. With the increase in the matching rate that we would get, we would net about $700 million. So that is money that would more than pay for the cost of Medicaid expansion and also help us to even pay for other long-term needs like K-12 education, making sure we're fully funding education, making sure we're paying for childcare and other essential needs. That money can be used for those purposes as well. So those are some of the real urgent needs, is to really think about Medicaid expansion as a way to infuse the state with money for healthcare, but also to help us prepare for long-term needs for our families in our state. So thank you.
Good morning, everyone. I am stuck on my mask. I'm Laura Colbert, the Executive Director at Georgians for a Healthy Future, and I wanted to start my time with you all this morning reading a story from a Warner Robins woman. Her name is Kristen. She shared this with our organization actually recently, and I thought it was a good example of somebody who would be helped by Medicaid expansion. She says, I fell into the coverage gap while in college. At 25, I was a non-traditional student and a new mom. I was working on weekends, staying home with a child under the age of 2 during the day, and attending school at night full-time online. My husband was working weekdays and weekend mornings. The Affordable Care Act had passed, but we didn't work enough hours to qualify for health insurance in the marketplace and made, quote, too much money for adult Medicaid, even with our combined incomes. We turned to our hospital's indigent care program for help when we had an urgent need for care. I graduated college with a degree in healthcare administration and a focus in community health. I had to give my final presentation with pneumonia because I had no access to healthcare. Expanding Medicaid is a must. Kristen and her husband live in Houston County. Houston County has about 12% of residents are uninsured, and of those, 5,192 of them would gain coverage if Georgia leaders expanded Medicaid. That's 5,192 folks just in Houston County and close to 500,000 people across the state of Georgia. 1 in 4 of the adults in Georgia's coverage gap are parents, like Kristen. More than half are women, and 7 in 10 are in working families, also like Kristen's. 6,500 Georgians in the coverage gap are veterans, like many of those in Houston County and Warner Robins around the base there. For almost a decade, Georgians for a Healthy Future has been on the front lines of this debate around Medicaid expansion, and in that time we've seen uninsured Georgia adults, parents, and working workers left disappointed again and again as our state leaders fail to act on expansion. And so 500,000 Georgians cannot meaningfully take part in the healthcare system simply because they live in the state. In that time, 600 studies have been published that demonstrate Medicaid expansion's positive impacts on chronic disease, cancer, and maternal mortality, on state economies and rural communities, on hospitals, community clinics, and healthcare providers, on mental health and substance use recovery, on racial and geographic disparities, and on non-health factors like food and financial security, housing instability, and recidivism to prison and jails. I actually brought the list of 600 studies with me today in case anybody would like to see them. Their seats are here. Georgia has waited so long to act that even Congress got tired of waiting. And so as Laura and as Representative Wilson have mentioned, they have incentivized our state to close the coverage gap through the American Rescue Plan with a $2 billion incentive. Again, $700 million of that would be extra that we could put towards other needs that our state would benefit from, like education, like worker retraining programs, like other recovery needs. 38 states have expanded coverage so far, and not one of them has backed out. Even Oklahoma, one of the reddest states in the country, expanded Medicaid earlier this year, and their enrollment has been a big success so far. This mountain of data is undeniable, the stories of Georgians in the coverage gap is undeniable, and the financials of Medicaid expansion are undeniable. And yet, Georgians who have fallen on hard times and need healthcare services and security still are denied again and again. Medicaid expansion is good policy, and it's time for our Georgia leaders to act. Thank you for having me this morning.
Thank you all again, and if you have any questions, we'd be happy to answer them at this time.
Senator Warnock and other congressional Democrats have proposed workaround measures. I don't think anyone's mentioned that here today, but do you see what you're talking about today as being a better option to try to work directly with Republicans, or at least apply more pressure for them to do something now rather than try to create some sort of workaround?
I do, and I'll let anyone else speak on this who wants to, but the key here is Congress has said, Senator Warnock has proposed a federal program to expand Medicaid at the federal level. people and the federal government would control that program. We have an opportunity for the state to accept responsibility, ensure nearly 500,000, if not more, Georgians, and give them high quality healthcare access and control the program here.
You mentioned that there were financial incentives at the federal level, and obviously there's been a debate in the General Assembly for a long time. Do you see anything different coming up in this special session that might push Republicans to kind of get on board with it? Is the situation any different?
I'm sorry, ask your question one more time.
So we have these federal financial incentives, and a Republican-held government still doesn't want to do it. Do you see anything different in this special session that might make Republican lawmakers lean more toward expanding?
Thank you. Yeah, what has changed is the urgency. And we've seen, in 2019, the legislature empowered Governor Kemp to pursue a waiver program. That has all but been rejected by the federal government and will probably be outright rejected in the next week or so. We've also seen that courts have consistently struck down waiver programs that have work requirements in them, like the one in Governor Kemp's proposal. So we know that that plan is not going anywhere. At the same time, Congress, since we have adjourned our legislative session here in Georgia, Congress has upped the ante and put more money on the table, more opportunities for Georgia. So it has never been more urgent, especially as we continue to fight the COVID pandemic. We see how healthcare access has become a critical issue for Georgia. Georgia has the third highest population of uninsured people, and fully expanding Medicaid would take a giant chunk of those people and give them access to healthcare. Yes, sir.
Do you, the legislature is on record from, I think, way back when Obamacare first passed, within a couple of years, the Republican-controlled legislature passed a bill that said Georgia can't expand without the legislature's approval. So I'm assuming then that you have to pass something in the legislature to supersede that, right? Is that what you envision doing?
That's right. That's why we have to act now. That's why we need Governor Kemp to include this in his call for a special session, because Georgians can't wait until January for the regular session.
I'm gonna ask a devil's advocate question here, and that is that you are running for insurance commissioner, so there are gonna be some Republicans who say that this is a campaign stunt. What do you say to that?
Sure. Well, right now I serve as a state representative for House District 80, and this is a legislative priority. We've both caucuses, I should say, have made that perfectly clear. And I am running for insurance commissioner because I think we need an insurance commissioner who is more out front on this issue that affects so many Georgians. And I would love to know where Commissioner King stands on Medicaid expansion. He should be here calling for a full Medicaid expansion. Anyone else?
Well, I do have sort of y'all kind of referenced a time frame that maybe in the next week or so, the state's proposal might be officially rejected. What are y'all basing that on? I wasn't familiar with any kind of time frame that was out there.
I don't know anything that you don't know, but the governor's waiver proposal was initially set to go into effect July 1. That was postponed by the federal government while they worked out the work requirement issue until August 1st. Since then, the Biden administration has made very clear that they will not approve a waiver proposal that includes a work requirement. If you look at the actions that they've taken in other states where the Trump administration approved work requirement programs, the Biden administration has stepped in and removed that approval. And so we know how this is going to play out. The Biden administration is making that perfectly clear. We also know should Governor Kemp's administration decide to fight it in courts, we know how that will turn out. This has already been doomed from the start. And like I said, the urgency requires us to act now. Okay, thank you all very much.
Thank you.
Thank you.
Yeah, let's get a